Now, health workers are at the front line of the fight against COVID-19, not just in South Africa, but across the world. But they too need to be protected so they can protect their loved ones. Now, Ubuntu Beds is an organization that's hoping to find a solution for these heroes. I'm joined by Ubuntu Beds founder Kim Whittaker via Skype to find out how they plan to help. Kim, thank you so much for joining us. Tell us what Ubuntu Beds is about. How did you decide that this would be a great way to help those South Africans that are really putting themselves on the line to save as many of us as possible?
Thank you so much. So I guess in the spirit of Ubuntu, the idea, of course, is that I am because we are, and in times of need, we need to look out for each other. I was on a call a few weeks ago with a doctor in Italy, in Lombardy. Someone asked him, what would you have done 2 weeks ago if you knew what you knew today? And he said, I would have spoken to all the hotels that are now closed, and I would have arranged accommodation for the doctors and nurses because they're exhausted. They don't want to go home to their families and risk infecting them. Now, I am in the hospitality industry in South Africa, and I could see that the tourism was really coming to a grinding halt. And I knew that our rooms would be imminently empty. And so I thought, that's what I can do. I can help in this way. I can offer our rooms. So as I started speaking to hospitals in our areas in Cape Town and Johannesburg, I realized it's quite a bigger need and a national need, and we don't really know where the coronavirus will peak. So we decided to build a platform called Ubuntu Beds, and we appealed to hospitality owners, so B&Bs, guest houses, backpackers, hotels, to list their beds on the website, and also to healthcare workers to their needs. So, for example, wherever they are in the country, to say whether they need accommodation close to the hospital where they work. The aim, of course, is to save commute time and, more importantly, to save the risk of healthcare workers bringing the virus back home to their loved ones.
Now, explain to us how it would work, because obviously now if you're looking at there being a travel ban, hotels and B&Bs being asked to close down, they don't have any customers coming in, this obviously is a great idea, but it comes with a risk again to staff who need to look after these hotels and B&Bs where we are hoping to house our frontline workers. How are you managing that aspect of this challenge?
So first of all, let me start by saying that the service that we're providing is a limited service. So it wouldn't be, so you might use a hotel facility, but it wouldn't be to the level that one might normally expect of a hotel. So the daily cleaning of the rooms, the daily servicing of the rooms, our guideline suggests that we clean and service the rooms once a week. It includes a deep clean in the beginning, where possible using a professional service. So, for example, in Cape Town, we've used a professional service to deep clean our premises. Once the healthcare workers check in, it is a very, obviously, social distancing applies, so maintaining a 2-meter distance between the hotel staff and the healthcare workers. And then it is a very, distant relationship. It's not like you don't have that warmth and that level of service that you might expect in ordinary hospitality. It is very much more distanced, basic staff, basic services, and we're working with the National Department of Tourism, and of course the Department of Health has issued a number of guidelines that are updated almost weekly on how to service hotels and accommodation.
So how is all of this working from a funding point of view?
We're busy fundraising at the moment. A portion of the people who've listed on our sites to offer their accommodations have offered them completely free of charge. So these are really, hospitality owners who have the capacity to give, let's say, an Airbnb apartment or perhaps they have a guest house on the premises and they're able to provide 2 or 3 rooms or 10 rooms absolutely free of charge. So we're busy filling those rooms first. The rest have offered them at very much a cost level. So let's say 100 Rand a night, 200 Rand a night, 300 Rand a night, and we're busy fundraising for that. We've recently joined forces with the RMB Spire Fund, and we're looking at ways of fundraising together so that we can make this project possible on a national level.
Okay, thanks for that update. Yeah. Kim Whittaker is the founder of Ubuntu Beds, and if you want to find out more, you want to offer up rooms or beds in your facility, you can find them. If you just Google Ubuntu Beds, you can find their website. And of course, if you are a frontline worker who's watching us right now and is worried about putting your loved ones at risk by continuing your work, go and check out that website as well.